Welcome, everybody, to another edition of Pain and Revival podcast. My name is Dr. Michael O'Halloran from New York. My associate and partner in crime is...
Nevaeh Grace.
And where are you?
In Georgia.
Georgia. Okay.
Yeah.
And you guys just had a little bit of weather coming through your place in the last week and a half or so. How you doing?
I'm good. Our poor town is taking a little bit of a beating, but we're sure it's gonna get better. Everything's gonna come together. But how's everything up in New York?
I mean, it's beautiful. The weather's beautiful, but we're sending a lot of prayers for our friends down in North Carolina, South Carolina, Georgia, and now another storm approaching Florida. So we're just praying for everybody to be safe.
Yes.
So on a lighter note, today we're going to talk about something fun that we both know a lot about. Okay.
Mm-hmm.
And it's kids and chiropractic.
Yeah.
So having been in practice almost 38 years, one of the most exciting things to be a chiropractor is taking care of pregnant women and children. I always say when a woman's pregnant, I just always visualize another new patient coming in, because as soon as a baby is born, they should be adjusted. And people ask me all the time, why would a child get adjusted? And I explained to them, I said, the birth process is a very traumatic experience, whether you have a C-section or a VBAC delivery, that there's a lot of turning and twisting of a baby's head. And that turning and twisting of a baby's head can cause the small bones in the neck to sometimes move out of place. And if they move out of place, it can cause a problem. Have you ever heard about kids being adjusted?
I have lots of them. I was adjusted as a baby first when I was like 6 weeks old, I think.
Wow.
So I get it on another level. Yeah.
Really? Now, why were you adjusted? Were you sick? Did you have a problem?
I think I was just a really whiny baby all the time, and I think I had like some ear infections. I'm not sure the whole story, but I did have I probably colicky and things like that. So, but then when I was adjusted, I immediately stopped crying, and I was happy baby ever since then.
So cool. So what a lot of people don't realize is one of the things we like to educate people on, and one of the reasons we do our podcasts, is something as simple as chiropractic care can make the difference in not only in a baby's life, but in the parent's life. Because when you first have a child, your entire world is upside down. Your sleep patterns change. Your entire life changes. And what happens is during the birth process, like we started to talk about, those little bones in the neck can sometimes move out of place. And if they move out of place, they cause pressure on a nerve. The pressure on a nerve can cause a symptom. Like Nevaeh was saying, is it could cause a symptom like colic. It can cause digestive issues. It could cause reflux. It could cause just an irritable baby, or the baby not to have the correct ability to sleep. So that's what we do as chiropractors.
Right. Yeah. And baby, and a lot of people would say they don't understand why a baby should get chiropractic care, because they're and a lot of people's, thought process is well, they haven't been through anything, but the very process of being born is a traumatic process, as I'm pretty sure we've talked about it in other episodes, but it's very traumatic. And you can get a subluxation just by being born, especially if you're born in a hospital.
Whoa. What's a subluxation?
So it's that thing that you were talking about when a bone is
I like this. 14 years of age, and you know what a subluxation is, because the average viewer out there right now has no idea what we're talking about. And they're still saying, why would you bring a baby to a chiropractor?
That's true. So yeah, it's just when your bone, I'm not the best at explaining it either, but when your bone is pressed on a nerve, and that is what a subluxation is. I always like to explain it as it's a kink in a hose. So when there's a hose and a kink in a hose, I mean, you can't, the water
to take care of.
Yeah. The water does not properly come out. The pressure, the pressure of the water isn't fully coming out of it. And so what you do when that happens is you remove the kink. And that is essentially what a chiropractor does, but for the bones, and they do it for your babies as well.
Brilliant explanation. People come into the office and they want me to, I say, if you want me to get technical, I can explain to you about the neurodynamics of a vertebral subluxation, or I can tell you a bone moves out of place, puts pressure on a nerve, wherever the nerve goes to doesn't work right. Just like I said. So the simpler you keep things, the easier it is for people to understand.
Exactly.
So during that birth process with that turning and twisting, sometimes those little bones in the neck can move out of place. And then what happens is, that's the term we call a subluxation. So it's a bone in the spine that moves out of place and puts pressure on a nerve. At the upper part of the spine, it can even affect an area of the body called the brainstem. that's when you get more serious symptoms or more serious effects. And we'll talk about that in a minute or two also. But people always say, Doc, how would you know a baby needs to be adjusted? Like nowadays, most people know someone whose child goes to a chiropractor. It's almost, I won't say common knowledge, but you know what? The world is becoming more educated about healthcare, and people are more interested in natural healthcare and being least invasive. So I explain to patients all the time is some of the simple little ways to check your child is if you put your baby in the car seat and all of a sudden they always turn their head to one side. Put them in the car seat, always leans to the same side. Go to change them, put them on the diaper pad, always goes to the same side. What happens is that's a sign of a subluxation, because when you're in utero and then go through the birth process, sometimes what can happen is those bones in your spine move out of place. And if they move out of place and stay there, that's what we call a subluxation. And what chiropractors do is we remove that subluxation. What do you got, girl?
Nothing. I'm listening. I'm invested in what you're saying, but
Okay.
A lot of the time, no, I mean, I agree with you. Like a lot of the time, that is the case. Like what I was explaining is like the birthing process. So I always think it's the best thing for your baby to be adjusted like a couple days old, because
now, are you better, or do you still have to go to the chiropractor?
No, you still have to go to the chiropractor. I mean, it's like wellness care, you know.
What does that mean? What is wellness?
Just to make sure that you're well. It's no different than when you go to like the doctor has they have like a yearly checkup, and you have to go and the dentist, you have to go and make sure that your teeth are clean, everything's good. Nothing's wrong. Nothing actually is wrong, but you have to go to make sure there isn't. And that's what you do at the chiropractor. It's just to avoid problems so that over time, your bones don't get wore down, and you don't have a more serious problem on hand when you're older.
So Nevaeh is brilliant in her description of what it is we do, because what happens is people say, okay, I check, you check my child, doc. You come into the chiropractic office and we do an evaluation. We say, okay, you report that the baby always tilts the head to the right side. You tell me that the baby's sleep patterns aren't good. The mom or dad may tell me that they have reflux, constipation. There's all different issues or symptoms a child can have. The child can't tell you they're in pain. So what happens is, as a chiropractor, we analyze their spine. Okay, how we do that is with the head tilt. We use a heat instrument that can check from side to side. We can actually look at leg lengths. There's different analysis we do with a 2, 3, 4-month-old baby, or even a 6-week-old baby, whatever it may be. And by analyzing that child and then gently correcting what's causing the problem, that's what gets the body just to work better. Like the correction on a child is easy. Like, someone may come into my office and they could be 50 years of age. And I check them for a subluxation, and we find out they could have a subluxation, and it could be there for 18 years. It takes time for correction. When you bring your child to a chiropractor, especially right after birth, if there's a bone out of place and that child's 2 weeks old, how long do you think the bone's out of place? 2 weeks. It's really simple. So it's a lot easier to correct a child. And it's a lot easier, I tell people, is to raise a healthy child if their spine and nervous system are where they're supposed to be.
Right. Yeah.
So when you go to the chiropractor, how often do you go?
Once a week.
Okay. And when you go once a week, what do? Check your spine.
Right. So and I don't get adjusted every time I go either.
Okay.
Why not? Because sometimes there's nothing for them to, there's nothing for them to do. They just have to check. They have to check to make sure everything's okay. It's like we talked about, like the weekly checkups.
You got a great chiropractor.
Yeah.
You did a great chiropractor.
So he checks me and he just makes sure that everything's fine. He does the leg checks, like you said. So if one of my legs is shorter than the other, then he's probably going to adjust me. But you don't always need adjusted, not every single time you go to the chiropractor. I feel like that's a misconception. Just because your chiropractor didn't do anything that time doesn't mean you should stop seeing them. They're doing their job. You didn't need anything, and that's a good thing. That means what they're doing is helping.
So if you went to the dentist and the dentist said you had no cavities, would you be mad? And you don't need to have a filling put in? Yeah, that's what the misconception is. I tell people that all the time. Folks come in and say, what do you mean I don't need to be adjusted, doc? I'm like, you're holding your adjustment. Your body's working at 100%. You're going to complain about that? Or would you rather wait when your body's working at 60% and you come in with symptoms and now your body's breaking itself down? The goal and overall scope of chiropractic, and especially when you practice principled chiropractic, is you check and detect a vertebral subluxation. You see if a person needs to be adjusted at a specific level. By adjusting that person at a specific level, you make a correction. You bring that person back to check and make sure the correction is what we call holding, meaning that the adjustment you gave now is staying in place. The body's back to functioning as close to 100% as possible, and then you maintain that. So chiropractic is maintenance. Like people, they think, oh, I love when people say, I heard if you go to the chiropractor once, you have to go the rest of your life. I'm like, only if you want to be healthy.
Right.
They don't like that response, but I said, you know what? I go and get my spine checked every Sunday. Okay. I'm blessed to have a chiropractor that's open on Sunday. So I go to church and then I drive to my chiropractor, and that's how I start the week. I make sure I'm spiritually unconnected, physically unconnected, and that's how I start my week. And people will say, well, what's wrong with you, doc? Why do you need to go to chiropractor? I said, nothing. I'm healthy, but I want to maintain working at 100%.
Right.
Right.
Yeah. So you just said something that I'm sure a lot of people would be confused, and I understand what you're talking about, but what is a principled chiropractor?
Great question. Is a principal chiropractor's focus is location and detection of a subluxation. That's it. We don't sell vitamins. We don't use modalities. We don't use traction machines. And other chiropractors can do that. So I'm not saying what other people do is right or wrong. I just tell you what a principal chiropractor does. And the original chiropractic principles back from 1895 that Dr. D.D. Palmer founded and Dr. B.J. Palmer developed. What happens is they located and detected a vertebral subluxation. We're going to say subluxation for now. They found a subluxation. They correct it. They maintain the correction, and that's it. That's it. There was nothing else to sell. So chiropractors over time, some of them got into a little bit of physical therapy. Some people got into massage therapy, and that's okay. That's their thing. But a good principal chiropractic, a good strong family chiropractor, and that's what I am. I'm a family chiropractor. So yesterday, I had a new patient that came in, and Jack was 3 months old. And Mama came in and said that Jack has reflux. And unfortunately, or fortunately, on the social media groups in New York, they call me the poop doctor. So we have what they're called moms groups. And one of the groups is called the Massapequa Moms Group in the town I practice. And there's over 20,000 women in that group. And what happens is someone said, does anybody know the poop doctor's name? So at first I thought it was a negative connotation, but then what happens is if you're the poop doctor, everybody realizes if you have a child with reflux problems, digestive problems, constipation issues, you go to this guy. By me checking the child, removing the subluxation, getting the body to work 100% again, the baby's better without the use of Mylanta and all these other medications that you're going to get either in CVS or from a gastroenterologist.
Right. A lot of moms, I would say, might be scared to take their child to a chiropractor because a misconception that's in the media and the news is that we crack bones. Yeah. So what would you have to say to that, to someone who's scared because they don't want their baby getting cracked?
If you go back to, I think it was Dr. Sue many, many years back, said if you take the weight of a dime on the tip of your thumb, okay, that's how much pressure it takes to move a bone out of place in a child's spine. So if you ever watched a toddler learn how to walk and how many times they land on their rear end, okay? Or if you've been through the birth process or watched the birth process and seen how much turning and twisting there is of a child's neck, or you've watched a child sitting on a plane and they have an iPad and their head is down like this for a 3-hour flight, all those things can cause a subluxation. By gently, now if it takes a weight of a dime to move it out of place, how much pressure does it take to move the bone back in place? Right. The weight of a dime. So if you take the weight of a dime and put it on your finger, when I adjusted little Jack the other day, that's all the pressure it needs to remove that subluxation. So there's no pressure at all. I have 3 boys, and all my boys have been adjusted since they're literally 5 minutes old. So they all get their spines checked once a week, okay? Because it's what we do for wellness. So what happens is at 5 minutes old, all 3 of them were subluxated from the birth process. Whether it was a vaginal delivery, a C-section delivery, nurse midwife, home birth, they should always be checked. Always.
Right. Yeah. Also, I'd like to clarify earlier, you mentioned, talking about a principled chiropractor, and we only do chiropractic and adjustments. There's nothing wrong. We're not slamming you if you do you have vitamins in your office, supplement, whatever you're selling, that type of stuff. That's your choice, but that's not what we do. So, and I know you clarified that, but I want to make sure that people don't get offended and they're not like,
I always tell people that's what chiropractic is. Chiropractic is, if you look at in New York State, okay, that's all I can tell you is that's where I practice. The description of what a chiropractic can do, according to New York State Department of Education, says it's the location and detection of a vertebral subluxation and removing that subluxation. That's our scope of practice. People add things to it, but that's not chiropractic.
Right.
There's nothing wrong with nutrition. I love nutrition. There's nothing wrong with eating healthy. I love eating healthy. There's nothing wrong with exercise. I love exercising. But that's chiropractic.
Right. Yeah. And I was just going to say,
Yeah.
like, there's nothing wrong with like massage therapy. You want to go get
No,
massage, it's fine. There's nothing wrong with even a medical doctor. I don't think there's anything
I
wrong
love
with
medical
that.
doctors. They're my best patients.
Right. But,
Yeah.
it's just not chiropractic, and we need everything in moderation. So everyone is needed. And
When I was in school a couple of years ago, 38 to be exact, is one of the teachers taught me something that stayed in the back of my head. He said, you want to try the most conservative thing first, which would be chiropractic. The second thing would be medical care with maybe medicine or some kind of pharmaceutical. And third would be a surgery. So there's nothing wrong with any of those three. It's how you go to each step that's really important. So if you're having an issue or a health issue, the first thing you want to do is check your spine and make sure your nervous system is working as close to 100% as possible. If it is, and you're still experiencing a symptom, then the next thing you might want to do is go to the doctor and find out about a pharmaceutical. That doesn't work. Sometimes there's need for surgery. So we're not against any of those things. They're all necessary, but the better you care you take of your body, the less chance you'll need the other two.
Right. So yeah, and it always breaks my heart when I see young kids like 5, 6 years old, or even like younger that are on medications and things and they've never been adjusted. They've never even tried that route. They don't even know what a chiropractor is, because it's just so heartbreaking, because they could probably avoid that if they just got their spine checked. So
simple. So simple. So what happens is, we're going to do a little recap, okay? Is when we talk about kids in chiropractic, first thing, what causes a child to need to be adjusted, okay, is trauma to the spine. The trauma can be a birth process. It could be a fall. It can be posture. It could be iPads. I see the kids in my office all the time, no matter what age they are, they're all on their phones waiting to get adjusted. So there's what they call forward head posture. So all those different things. So that's number one. Number two, how the subluxation occurs is the bone actually moves out of place, puts pressure on a nerve. Pressure on a nerve causes a loss of nerve flow to that particular area. And that loss of nerve flow, or life flow, as we like to call it, that's what causes our body to now cause dis-ease, not disease, dis-ease. So the body starts to malfunction. If the body malfunctions for a while, then it causes disease. Okay, so there's steps to your body breaking down. Because all the time people say, I say, when was the last time you had your nervous system checked? And they're like, well, what's wrong with my nervous system? Okay, but think about that. If your nervous system controls every single function of your body, okay, and you have a beautiful little 6-week-old baby that just went through the birth process, and you could take the pressure of a dime, put it right there on the top bone of the neck called the atlas, remove any interference, and now that baby goes back to functioning at 100%, sleeps better, poops better, digests better, does all those things. It's really a simple concept. It's just more and more people are just finding out about it, which is awesome.
So you just, I don't know, through you talking, I just kind of had like this thought flash. So what happens when a mom is subluxated and then they have a baby? Does that affect the baby?
They won't. It's not like it's a genetic thing. So a subluxation won't get passed down to a baby. That's a great question, actually. But what happens is a mom that delivers, which is really important that Nevaeh just brought this up. So say it was their pelvic area, their hip bones or the lower spine, that can actually decrease your chances of a natural delivery, because the birth canal that a baby has to come through, if that's out of balance, the hip bones that comes down to, or the pelvis area, if they're out of alignment, that can increase your chances of having a C-section delivery. So a great point Nevaeh made is, if a mom's pregnant or planning on getting pregnant, you definitely want to get your spine checked to make sure that you're in alignment. Because if you're in alignment and your hips are balanced and your spine is balanced and your body's working at as close to 100% as possible, it decreases your chances dramatically of having a C-section delivery. Now, as soon as that baby's delivered, okay, and it's quite often in my office, not only does mom come in with a 3, 4, 5 day old baby, but mama comes in and gets herself checked also because she realizes what she just went through during the 9 months of pregnancy.
Right. Exactly. Yeah. It's wonderful. I
Beautiful.
think this is very educational for everyone. I think this is going to be something that's really important. Everything we've said is very important for the public to know because I feel like we cleared up a lot of misconceptions that a lot of people have about chiropractic care and babies.
And I can tell you something in New York, and New York people say, oh, well, you live in New York, everything's more expensive, is just to give people an idea. And most people don't talk about insurance. But in New York, for me to be a chiropractor and practice in New York State, my malpractice insurance is the equivalent of my car insurance. Mm-hmm. So it's really not like, so people think, oh gosh, it could be dangerous to have a chiropractic adjustment. Complete opposite. Okay. It's just as safe for me to adjust a 3-week-old baby, and don't get nervous with this, as it is to drive with me in a car in New York without any tickets or accidents. Yeah. So what happens is, people need to realize this. It's so safe. It's so effective. Chiropractic's been around since 1895. Think about that. All right. Mm-hmm. If it didn't work or it wasn't successful, it wouldn't be around that long. The number of children getting adjusted increases every year astronomically. Astronomically. I see more kids this year than I did last year. I saw more kids last year than I did the year before because moms are becoming aware and saying, hey, you know what? I don't think my child's suffering from a lack of Mylanta. I don't think my child could be allergic to every single formula. What you realize is if that bone in the spine is out of alignment and that's affecting your digestion doesn't work the way it should. By removing that interference allows the body to digest, allows the body to be peaceful. And you know what peaceful babies do at night? They sleep like a baby.
Right. So it's I would say that's probably very important that you research your chiropractor that you're planning on taking your child to, because I feel like a lot of moms, they go to one chiropractor and they don't like the way that they treated their kid or even if the chiropractor did nothing wrong, maybe they just didn't explain what they were doing as they were adjusting this kid and it might have scared the mom away. But make sure you research your chiropractor, make sure you research chiropractic, research everything before you put your children in it. Even for yourself, just research everything, research chiropractic for yourself, see if it's what you need.
So let me ask you a question because we got a couple minutes left. How long are you going to get adjusted for?
Since I was 6 weeks old. So
how long do you plan on getting adjusted for?
Forever.
And you have any future plans in chiropractic?
Well, yeah, I'm going to be a chiropractor.
Why?
That's a long story, but because it's changed my life and I've seen the way that it's helped other people, adults and children. I've watched it through my own eyes do miracles that I haven't seen the medical world do. And I've always been one that's wanted to help people. Yeah. And this just seems like my way to be able to help people perform and function a healthy lifestyle and actually live.
I love it. So that's what happens is a lot of times you'll see people when they're under chiropractic care, it not only makes them clearer, that they can think better, they can function better, their bodies feel better. But what happens is it opens up a part of your space or a space in your brain, I believe, that makes you, and so many folks that have come through my office have researched into becoming chiropractors, going to chiropractors, even when they move away, and it's a hard thing because it becomes a relationship, just almost part of your family. So when someone moves away, they always say, Doc, can you do me a favor? Can you find me a chiropractor like you? And I said, you know what? There's no chiropractor in the world like me. Okay. Mm-hmm. First of all, I'm one of the best that I've ever met. Okay. And I don't say that from an egotistical point of view, but we train 4 times a year. We go down to something called the Dynamic Essentials meetings in Atlanta, Georgia. And then we're down in the winter months in Florida, which is always beautiful. And we train with chiropractors from all over the world. Okay. We not only train on our philosophy to make sure we're strong in it. We focus on our service hand. Okay. What does that mean? It means that a principal chiropractor is if they focus on what they do and focused on our art, okay, that's one thing. But if your mind is not clear and you're serving for the wrong reason, that can affect people. So we train 4 times a year minimum, okay? Where we go down to Atlanta, Georgia, and we go down to Clearwater, Florida, and we go down there and we study with other doctors, and it just improves. And I'm in practice 38 years, okay? So I've been going down to the Dynamic Essentials meetings for 33 years, just for making sure that I'm as good as I can be to serve my community and to serve humanity.
Yeah. And I think it's very important that all chiropractors, you get around your people so that you can be the best chiropractor that you can be. And that's a big thing that we talk about at DE is like, I'm the best chiropractor in the world, because you are. And if you don't believe that, I don't want to go to a medical doctor who thinks they're the worst doctor in the world.
Yeah.
I don't want to go there. I'm going to be like, ew, get away. Like, you probably don't know what you're doing.
You go to a hospital, you want to have the top surgeon. You want to have the head of neurology. You want the head of, pediatrics. Okay. Mm-hmm. Same thing with chiropractic. You want to make sure that you got a good, strong, philosophical chiropractor that knows what they're doing, that takes care of families, that serves a lot of folks. And that's who you want, taking care of you and your family. And that's one of the key things is, and chiropractic care is family care. Most of the patients that come in my office come in as a family, and the entire family gets their spine checked. And the reason we're big advocates of that and big proponents of it, it's what my family does. So what happens is if I do something with my family differently than I would do with other people's family, there was a little incongruency with that. So I just believe that if everybody gets their spine checked, okay, the entire family, make sure their function is close to 100% all the time, it builds peace and harmony in that family, makes the love easier, makes the family bond stronger, and just keeps everybody healthy and happy. And it's just freaking awesome.
Exactly. Yeah.
So girl, anything you got to say in our closing?
I don't think so, but I think we should get our babies adjusted, and so that we can have a better world. Everyone talks about the world being so horrible now, but
that's a perfect thing to close on.
If we get our babies adjusted, maybe the world can be a better place. Maybe it's just a little action step in fixing it.
And amen. Coming from 14 years of age, shooting back to New York at 64 years of age, there's so much stress in the world, okay? Mm-hmm. From people reading the newspapers, watching the news, the stress in the Middle East, the stress everywhere, okay? And what happens is that stress affects us. And by simply receiving a chiropractic adjustment and getting our body just to be as peaceful as it can, like Nevaeh said, you know what? It'll be better. It'll just be better. So there's people coming up in the forefront like Nevaeh that are, she's been adjusted since she's 6 weeks of age. Can you imagine when she gets to share with her patients? I've been adjusted since I'm six weeks old. And the next question, they're going to say, why? What was wrong with you? I needed to be adjusted. And now what happens is I get adjusted to maintain my health. And that's what I do. That's why Nevaeh gets adjusted once a week. That's why I get adjusted once a week. That's why we believe the average person in the world should get adjusted if you want to be healthy, clear, happy, and feeling great.
Exactly. Right.
Anything else, my beauty?
No, not at all.
Okay.
I think you said it all.
Appreciate you. We'll see you next week. In 2 weeks, we're going to maybe do a live broadcast, or maybe we're going to be filming from Atlanta, Georgia. So keep tuned. Have a blessed day. We love you and appreciate you.
Bye.
Bye.